Education. My name is Pinky and today I'm here with the news score. So today I'll explain about how you can complete the news score in the OSCE exam. So before moving further, if you have not subscribed to my channel yet, please consider subscribing it and press the bell icon to get more video. So in the OSCE exam, you have to complete the NEJA scoring. Only in the case of head injury, you have to complete the GCSE score. Otherwise, you have to complete the NEJA score in the OSCE exam. So NEJA score is a tool which developed by the Royal College of Physicians, which improve the detection and response to the clinical deterioration in the adult, and is one of the key element of the patient safety and improving the patient outcome. In this video, I'll give you one of the scenario, and based on that scenario, I will explain how you can complete NEJA score. So this is the patient information you are going to fill in the NEJA score. So the name of the patient is Elizabeth Simon. Date of birth is 01/01/1950 and date of admission is 27/09/2022. So in the exam center, usually date of admission would be the today date, the date you are going to give exam. The Elizabeth observations are: the temperature is 36.7 degree, pulse rate is 90 beat per minute, respiration rate is 19 breath per minute, oxygen saturation is 96% on air, so the patient is on room air, patient is not on the oxygen, and blood pressure is 110/78. So based on this scenario, I'm going to show you how you have to fill the NEJA score. So the patient name is Elizabeth Simon and date of birth is 01/01/1950 and date of admission is 27/09/2022. And date is suppose today date is 27/09 and time is 10 hours. So the date you have to fill when you are going to complete this NEJA score and the time of the same. So the respiration rate is first in the box. Respiratory rate of the patient is 19 beat per minute. So this box indicate the 18 to 20. So you have to put the dot in this box if the patient respiratory rate is 18 to 20. So as our patient respiratory rate is 19 breath per minute, so you have to put the dot in the middle of the box. Second is a saturation rate. So the patient saturation rate is 96% on the air, and the upper box indicate the 96% or the above than the 96%. So the patient respiratory, the saturation rate is 96, so you have to put the dot in the lower part of the box. And this is only for the patient who is having the hypercapnia respiratory failure, and this only will fail when the clinician or the doctor will tell you to do that. So in the OSCE exam, usually you don't have to fill in this box. As the patient is on the room air, you have to write the A in the A equal to air, or if the patient is on oxygen, you just have to write the liter per minute. As the liter per minute is already written here, so you just have to write the number. If the patient is in 2 liter of oxygen, you have to write the 2. And you have to write the device in this box. So if the patient is in getting the oxygen through the nasal cannula, you have to write the NC. If getting oxygen through the non-debreathable mask, you have to write NBM. So based on the device, you have to write in this box. Then another one is a blood pressure. So blood pressure of the patient is 110/78. So this box indicate that if the blood pressure of the patient is 101 to 110, you have to put the arrow in this box. So as the patient blood pressure, systolic blood pressure is 110, you have to put the arrow in the upper line. And if the patient blood pressure is 101, you have to put the arrow in the lower part of the box. And the diastolic blood pressure is 78, so this line indicate the 80. So as the patient diastolic blood pressure is 78, you have to put the arrow in the lower than this line, the 80 line. Then pulse rate. So as the patient pulse rate is 90 beat per minute, you have to put the dot in this box, 81 to 90 box. As the pulse rate is 90 beat per minute, so this dot will be in the upper part of the box. Then the conscious level. So as if the patient is alert, you have to put the dot in the alert box. If the patient is confused, then you have to put the dot in the confused box. If the patient is only responding with the voice, then you have to put the dot in the V. If the patient is responding with the pain, then you have to write the or put the dot in the P. If the patient is unconscious, then you have to put the dot in the U. Then the temperature, so the temperature is 36.7 and this box indicates the 36.1 to 37. Then you can put the dot in the middle of the box. And if you go back to the video and see all the scoring and calculate the scoring, then the score will be 1 because the patient blood pressure is 110/78. So when you are seeing the blood pressure, you just have to see the systolic blood pressure, not a diastolic blood pressure. So the systolic blood pressure was 110 and this make the Nugent score 1. And the monitoring frequency is if the patient Nugent score is 1 to 4, then the monitoring of frequency will be 4 to 6 hours. So based on your judgment, you can put 4, 5, 6 hourly. And escalation of the care is yes or no, whether you are going to escalate to the in charge or to the doctor. Based on your judgmental, you can write yes or no. So I have written N because the patient blood pressure is 110/78 and it seems to be normal for me. So what you can do in the OSCE exam is you can just ask to the patient whether your usual blood pressure is 110 or it's low. If the patient blood pressure is low for the first time, then you can escalate, you can write the yes here. And you have to write your initial of the name. National early warning score parameter value and score. So based on this new score, you have to increase the frequency of monitoring of the patient, and also you have to response based on this new score. So if the patient new score is 0, your minimal frequency of monitoring would be 12 hourly, and your clinical response would be continue routine news monitoring with every set of observation. If the patient needs score is 1 to 4, then your frequency of monitoring would be 4 to 6 hourly. And if you are not registered nurse, then you have to inform the registered nurse who must assess the patient. Or if you are registered nurse, then you have to decide if the increased frequency of monitoring or escalation of clinical care is required or not. If the patient total news score is 5 or more or 3 in 1 parameter. So if the patient is confused, then your news score would be the 3 in 1 parameter. So in this case, your frequency of monitoring would be a minimal of 1 hourly. And your clinical response would be as a registered nurse to urgently inform the medical team who is caring for the patient. Urgent assessment by the clinician with the core competency to assess acutely ill patient is required. Clinical care in an environment with the monitoring facility would require. If the patient total news score is 7 or more, then patient would require continuous monitoring of vital signs. And as a registered nurse, your clinical response would be to immediately inform the medical team caring for the patient. This should be at least at a specialist registrar level. Emergency assessment by the clinician team with the critical care competency, which also include a practice nurse with advanced airway skills. Consider transfer of clinical care to the level 2 or 3 care facility, that is higher dependency or intensive care unit. Thank you for watching. Please like my video and please subscribe to my channel and press the bell icon to get more video. Keep watching, keep supporting. Thank you.